advertise your business or your product. Call us on 0114 777 000 or email us on info@faithtodaytv.co.ke.
Every great journey begins with a single step. And at Jessica Hospital College of Health Sciences, that step is met with warmth, guidance, and possibility. Here, learning goes beyond the books. It is where future healthcare heroes are nurtured by passionate instructors who believe in their potential. From theory to practical, our healthcare assistant students gain real-world skills in a real healthcare setting, preparing to serve, support, and make a difference from day one. Because at Jessica Hospital College of Health Sciences, we don't just teach healthcare. We empower excellence. Admissions are now open for our May and June intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. Jessica Hospital College of Health Sciences, empowering excellent healthcare.
At JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital, you first.
Up to 80% of women will develop fibroids by the age of 50. Now that's according to the National Institutes of Health. But think about it. More often than not, many of the women will struggle with conceiving, they struggle with pain, and then some experience pregnancy complication just because of fibroids. Now, could fibroids be the silent obstacle that stand between you and motherhood? That's a discussion we want to have today. Stay tuned and do not go anywhere. Greetings and welcome back to yet another transformative episode of the Healthy You program. My name is Enock Kitondekijja, your host, and I'm so honored to walk this journey of health, healing, and transformation with you. A special thanks goes to JCK Hospital. Now, these are our esteemed partners. They make this program possible, and they're the number one advocates for health for the body, mind, and soul. Now, should you be looking for any health services around Nairobi, Murang'a, and Juja, you can reach them using that number on your screen. I also need to mention Jessica Hospital College of Health Sciences is now open for their October intake. You want to pursue your course in health assistancy, caregiving, this is the place to start. Thank you so much. Now, today's topic is one that you do not want to miss we're addressing a silent obstacle that is really affecting millions of women out there. We're talking about fibroids and fertility. And to help us unpack this important discussion is no ordinary gentleman, but a man who has worked with very many women out there, helped them along their journey to bear children, to become mothers. It's indeed a great time for you to understand what really happens if you are struggling to conceive. Now, he's not just a doctor, but he's also a consultant, an obstetrician and gynecologist. Now, that combination is one that you don't want to miss today. But before I invite him to take us to the next level, I'm aware of those of you who follow us on social media, and I just want to remind you to please subscribe. You do so well when you like this conversation, and even much better when you share with as many people as you can. Thank you so much. Back to my guest, Dr. Charles. You're welcome to Faith Day Television.
Thank you so much, Harry.
Thank you for joining us.
Thank you for having me.
Feel free to introduce yourself to our guests today.
Thank you. Hello, everyone. My name is Dr. Tung'ani Muchiri. I am an obstetrician, gynecologist, and a reproductive health specialist. I am honored to be here today to discuss such an important topic, one that is sometimes shrouded in myth, mystery, and at times even stigma. So today we hope to shed light on this topic so that people know. You know, the good book says, my people perish for lack of knowledge. So we should not be accused of denying the people of God knowledge. So welcome. Grab a cup of tea, a cup of coffee, whatever makes you comfortable. Invite a sister, an aunt, or even your husband so that we have a good conversation today. Thank you.
I love the way you started this conversation. I think I've not had this intro before. And I like it when you begin with scripture and knowledge, because so many people out there struggle with some of the things that we are going to be talking about here. And now having an expert like you to help us, break down it for people, it's a blessing to have you. How has been your week?
Thank you. My week has, let's say, just started.
Yeah.
We are just into Tuesday.
Okay.
But it's been a blessing so far. Quite a busy Monday.
Yeah.
And Tuesday here we are. So I'm loving it so far.
So far,
Yes.
so good. Thank you so much. Now that is Dr. Charles here once again with us on Faith Day Television. And we just want to start right away with the topic of our discussion is fibroids, Daktari.
Yes.
And we have so many people out there with a lot of questions, like you began talking about. There are myths out there.
Yes.
Let's cut through the clutter and address what really fibroids is
Yes.
and how does it typically present.
Okay.
Yes.
Let me start by first paraphrasing one of my patients who told me that these things, she was describing fibroids, these things are like uninvited guests who show up to your house, take up space, and sometimes refuse to go. So that to me was quite an analogy. But to be maybe a bit scientific about the definition is that fibroids are growths on the womb, that is the uterus. Think of them as lumps of muscle, we call it smooth muscle, growing on the uterus, anywhere on the uterus, whether on the wall outside or the inside. And they can be of various sizes and various numbers. So to start off is to say that they are not cancer and they don't always have symptoms. So if you were to think about an analogy, and another analogy is think of your sitting room. You place just enough furniture for you to be comfortable. Now, if you started adding many other things inside there, it would not be so comfortable. So it is the same with the uterus, is that there are other growths that are not normally there. Yes.
I love the way you bring out information to us. Today it's about analogies.
Yes.
You've talked about uninvited guests,
Yes.
who come and occupy space. You know, and sometimes we say there is no. I also bring out analogy. They say there is no smoke where there is no fire. You know, so there could be something that is attracting, because not everyone per se develops fibroids. I mean, maybe walk us through the journey of what really triggers these fibroids. Where do they come from?
Okay.
Yeah.
All right. Let me start by saying that even doctors don't know everything. And a good scientist admits when they don't know everything, because it leaves room for more research. So when it comes to fibroids, we are still not sure what exactly is the trigger. I mean, why would this woman get and not this one? We have what we call risk factors, but not exactly the causative factor. So there has been some theories, you know, when you can't explain something fully, sometimes we rely on what we call theories as to what could lead to that. And one of them is that the genes, there is a change in some of the genes that may lead to the growth of fibroids. That is one of the theories that we are following up on. Another one has looked at family history, that probably if your mother or your close sister had fibroids, you are very likely to also have fibroids. So probably that could be one of the causes we are thinking about. There are many others, some discussing things like diet and weight and so on. But those are more on the research stage. What we do know is things we call risk factors. For example, we have seen that in Africa, we tend to have more women getting fibroids, and them being more aggressive as compared to Caucasians. Like I also mentioned, that if there is a family history, that is also another risk factor. And of course, having a long reproductive lifetime. That is probably your menses started very early and you go into menopause very late. So you have a longer time when you're exposed to the hormones of reproduction. That has been documented as a risk factor. There are other less known or less studied, like diet. Some people say that diets that are low in vitamin D may predispose. Some people postulate that if you have a high body mass index, that is, if you are obese, you may be more likely. But those are less known as compared to the ones I had mentioned earlier.
So I hear you well. Only what we know is what has been documented. And I believe with research and studies, there's so much we can know about whatever is causing fibroids. But I like the idea, how you bring it out, that exposure to hormones for a long time could be a risk factor. And then starting your menses a bit earlier could be another risk factor. For those of you who are just tuning in, this is Faith Play Television. Again, we are discussing fibroids and their impact to fertility. So many women are affected. We are also unveiling today that mostly the African population is at a greater risk, and that is something that we needed to address today. Speaking of fertility, how do they get to now affect conception, fertility, childbearing, and motherhood? What's the relationship?
Okay. Probably even before we go to the issue on fertility, we can maybe talk about their presentation, because fertility is just one of the presentation that we can have. And it's good to note that not all fibroids cause problems. Okay, many women have, they are benign growths, they are benign, they are non-cancerous. So many women have them and they don't affect them. So like the way some people can have pimples on their face and it's not a big deal. So what determines who gets symptoms is probably the location, the size, and the number of fibroids. When we do have symptoms, the common ones are usually pain or heavy bleeding, and this bleeding can be in terms of the cycle is heavier or prolonged, or bleeding in between the cycle. Some people may now experience what we call pressure symptoms. Pressure symptoms mean that there is this organ that is usually small in size. It has now grown sometimes to very big sizes that looks like a pregnancy. So now it's compressing on the other organs. Top on that list is the bladder. So if the bladder is compressed, you may feel like going for a short call more times. If it goes to the gut, you may get constipated, you may feel bloated, you may feel a discomfort basically of the lower abdomen. And when now they start growing more in size, you may notice a bump on your abdomen. Some women even come and thinking they are pregnant only to find out that it's fibroids. Now, moving to the fertility issue, there are various ways they can cause issues with fertility. To start off, it's to say that it's not a must that they cause an issue with fertility. Indeed, many women conceive with fibroids. They carry pregnancy to term, and they are okay. Some even multiple times with no issues. But to use the analogy I talked about earlier, you have this room. It's meant for one person, the baby. Now these guys have come and occupied space there. Of course, that can bring problems. One of the problems they can do is that they can compress the tubes. Because for you to get pregnant, the gametes, the male gametes, have to pass through the cervix, through the uterus, through the tubes, so that they meet the female egg. Now, if there is a fibroid anywhere that is blocking that passageway, definitely pregnancy will not happen. And so that is one of the common causes of loss of fertility in women with fibroids. The other thing is that they can distort the shape of the uterus. If you have seen the images, you'll see the nice concave shape that the uterus has. It has an inside cavity. Now, if the growths start compressing that cavity, some of them may even grow inside. In fact, the ones that grow inside the uterus are the bigger problem, because they easily bleed, and again, they interfere with where the baby is supposed to attach. Because when the pregnancy forms, it has to attach somewhere inside the uterus. Now, if there are things that are distorting that shape, then the pregnancy may not implant. What we call implant is just attaching. If that does not happen, then there is a miscarriage early on in pregnancy. So that's the second way that these fibroids can cause fertility issues. Another way is that, yes, you've gotten pregnant, the pregnancy has attached, but the uterus has so many fibroids, or very big ones, that there is basically no room for the baby to grow. So you can end up having either a miscarriage late, or what we call preterm labor. That is, you deliver a baby that is not term. And of course, that is also not a good thing. That said, not all those things happen at the same time or to all women. So people should not generalize that if you have fibroids, you will have problems. Also, it's also good to note that even if you do get pregnant and the pregnancy proceeds, there are complications that can occur other than the ones I've mentioned. Bleeding is very common with these pregnancies. Pain during the pregnancy, because sometimes the blood supply is cut off from the fibroid and they start doing what we call degeneration. That, in a nutshell, is how they can affect the reproductive health of a woman.
I think that's very important for our viewers having the picture of what happens in there. Mm-hmm. You've talked about not everyone really gets these complications, even with fibroids, but also you wouldn't want to to have something grow in there, even though it is not painful,
True.
only to, interrupt your conception or that time when you really, plan for a baby, and then you are told now fibroid is in the way.
Yes.
Help us understand
Mm-hmm.
what are some of those red flags that every woman should look out for right now, or maybe on your end as doctors.
Yes.
What do you focus on? What should a woman know? Because ideally, every woman is a candidate as long as you have uterus, So help us identify those key factors or red flags that we should be aware of, so that we don't get these painless growth growing inside us, even though they are non-cancerous, but they can affect.
Yes. All right. So like I mentioned, we have the main symptoms. One is pain. If I was to pick the first two, I would put pain there. And this pain can be constant, it can be dull, it can be during menses, or it can be occasional with no pattern. Mainly located in the lower abdomen. And for some women, they say that it radiates to the back. Some women may describe as something that is cutting across the pelvis. Apart from pain, there is bleeding. And this can take the form of either heavy menses, prolonged menses, or bleeding in between the menses. And sometimes this can be severe enough to cause anemia. Anemia is low blood level, and now you can have the symptoms of anemia, like you may be fatigued, you may be feeling the awareness of your heartbeat. You may be getting headaches. You may look very pale when people look at you. You look white, on the mucous membranes. Apart from that, you can have symptoms of pressure. Like I said, fullness in the lower abdomen, constipation, going for a short call many times. You can also see growths, and it can either manifest in the abdomen, that is a swelling. Maybe sometimes you may even look like you're pregnant if they have grown to a really big size. Or sometimes they may come out of the birth canal. We've had what we call prolapsed fibroids, that it has grown so much that now it's starting to push out and you may feel a bulge. So whenever you have these symptoms, it's good to see, a healthcare worker, because that is where now we'll be able to do, our history, our physical examination, and the necessary investigations to come up with a diagnosis.
Speaking of diagnosis, I think that's the right direction to take for our viewers. He's going to help us understand, how do you discover these fibroids? Can a routine check, maybe just a walk-in the hospital, help you capture or locate these fibroids? Very, very important discussion. Now, for those of you who have any questions, again, this is Faith Day Television. Make sure you use that number on your screen. Utilize this time with our expert, and the earlier you do, the better. Remember, this program is brought to you by JCK Hospital. Dr. Ali, speak about diagnosis. Now, how do we get to that place where we,
All right. We used to say back in school that diagnosis is 70% history. I mean, what the patient tells you, if you listen closely, will give you a clue in 70% of the times. So it is very important that when a patient when a lady comes, the doctor takes time to listen, and the patient also gives, the full history without leaving out details. Apart from that, examination is very important, where you may be able to pick that the size of this uterus is not the normal size, or there is something firm moving here and all that. But on top of that, we need to do what we call imaging. Imaging is mainly an ultrasound. An ultrasound will give you a diagnosis in more than 90% of the times. Really, we've had to go to more extensive investigations, like an MRI and all that. But once we do the ultrasound and we see masses. There's a characteristic look that they have. We are able to pick that out. And now from there, it becomes now formulating a plan on how to go about it, depending on our findings. Yes.
Depending on your findings.
Yes.
Again, I like the background you've given us. I believe someone there is wondering how just a routine check can help them identify fibroids, because you see the challenge here is that they are painless most of the time.
Yes.
So what do you recommend for women? Can it be, picked on just a normal walk-in the hospital or check, or should they be intentional about doing probably we call it a scan or something like that? What's the approach to that?
Okay. Well, it's not recommended that you keep screening for fibroids if there are no symptoms, because, like I said, they are benign. So we reserve that for people with symptoms. The symptoms I mentioned, now those are the people we'll recommend that they do an ultrasound. Since an ultrasound is easy to do, it's non-invasive and it's fairly available and affordable.
Yeah.
We are able to do a diagnosis quickly. In fact, not many women will go undiagnosed for long these days. What now interests us most now from there is the dynamics. When I talk about the dynamics, I'm talking about what is the age of your patient, what are the symptoms, and what do they want solved, and what is the extent of disease, like how many fibroids, where are they located, how big are they. These dynamics will guide us in the next step. That is how do we manage them? Because if a lady tells you, okay, fine, they are fibroids, I have no issues, you may not be so aggressive. But she tells you, okay, I have been bleeding a lot and it's distressing me. The management might be different for the two. Somebody may come and tell you, okay, I have them, I have symptoms, and I still want children. So those dynamics now will come out clearly once we have all the information.
So information here is very key.
Yes.
I know we are going to take a short break, but before we do, help us understand about the approach, how you manage these fibroids. Is it always, because people think that it's always that when you have a fibroid, it has to be eliminated by surgery, operation. That's what people think. So is that the case, or there's a medical approach to it? Maybe also help us understand any other myths that surround fibroids.
All right. So one of the quotes that was drummed to us in school about a good surgeon said, a good surgeon knows when not to operate. And that case applies very much in the case with fibroids, because there are some of the conditions that have a wide range of management. And top on that list is actually do nothing. Let's say a woman has a small fibroid, it's not affecting her, and she wants to conceive this year. You would probably not do much about it. Because you want to give her a chance first to get a baby and maybe just monitor. So watchful waiting is an option. Probably I used the wrong words, because do nothing sounds like you've washed your hands. No, it's actually you're going to be monitoring her. You can make a plan for 3, 6, or whichever number of months, depending on the size and her symptoms. Next level is that you can manage only the symptoms. Okay, fine, you have pain, we can deal with pain. You have an issue with menses, we can give you some hormonal treatment to deal with that, to reduce bleeding and all that. If you go beyond there now, we are starting to be more aggressive, probably more intentional, because we have an option of doing what we call hormonal treatment. So we are saying that these things respond to the hormones of reproduction. So if we did block that, we can somehow arrest the growth. So there are some hormones we can give you. sort of now stops your periods, it stops your hormones, with of course a few side effects, but it can make them shrink. Now beyond there, we start being more direct in our treatment, and there are three options. There is what we call interventional radiology, there is what we call ultrasound treatment, there is what we call surgery. Probably I can get a bit more into that. So when it comes to interventional radiology, we know that they rely on blood supply to grow. So if we wanted to deal with them, if we cut the blood supply to the fibroids, we can arrest their growth. So there is a way radiologists do. They thread their way through a blood vessel with a small catheter, and they go all the way to the specific blood vessel and block it.
They're able to block
Yes.
food supply to these fibroids.
Basically, yes.
I mean, we can conclude it briefly there. It's just a supply of food or whatever to these uninvited guests.
Yes.
But I know there's more to this, and that's why we want to talk about this in detail in the second part of our discussion. Do not change your dial. We are coming back to discuss the approach these experts use to put an end to these fibroids and what you need to know today for you to be able to deal with fibroids, because there's an approach. They don't just wait until when they become, full-blown masses, head-like, whatever the name you could call it. But there's more to this in the second segment. So do not change your station. We are coming back in a bit.
Every great journey begins with a single step. And at JCK Hospital College of Health Sciences, that step is met with warmth, guidance, and possibility. Here, learning goes beyond the books. It is where future healthcare heroes are nurtured by passionate instructors who believe in their potential. From theory to practical, our healthcare assistant students gain real-world skills in a real healthcare setting, preparing to serve, support, and make a difference from day one. Because at JCK Hospital College of Health Sciences, we don't just teach healthcare. We empower excellence. Admissions are now open for our May and June intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. JCK Hospital College of Health Sciences, empowering excellent healthcare.
Faith Today TV is here to make your brand outstanding. Worry not on where to advertise your business or your product. Call us on 0114 777 000 or email us on info@faithtodaytv.co.ke.
Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV.
Welcome back once again to our second segment of our discussion. This is Face to Television, and we have an expert in the building. Dr. Charles here is weighing in on fibroids and fertility. These silent obstacles that could be standing in your way to motherhood. Very, very important. We have quality info in the first segment. This segment, he's going to continue helping us understand their approach on how they manage these fibroids. It's very important. It's not always surgery. It's not always an operation. There are a number of ways that experts deal with fibroids. So it's very important that you don't go anywhere. Those of you who are sending in your questions, again, do it through that number on your screen. And remember to like this discussion. And if you have a relative who is a lady or woman, you do well when you forward this discussion to them. Thank you so much. Daktari, we ended it at a point where you are sharing with us the approach to how you deal with these fibroids. Because some people think every time it's to cut. And also, I don't know if you guys enjoy cutting because you make money while operating, but you are telling us how you do deal with fibroids because it is not always surgery. Yes.
So we had talked about interventional radiology, where I said, and you gave a very good example of cutting off the food supply to the fibroids because they rely on blood supply to grow. So if there was a way you can just close off that tap, you can control the fibroids. And that is what interventional radiologists do. They pass a small catheter, like the same they use to do heart interventions. And then they're able to inject a few pellets that block that blood supply. So what happens is that over time, the fibroid is starved of blood supply and it stops growing and to a large extent shrinks. That is available in various centers, I believe in Nairobi and some other major towns. Another option coming up, we are trying to look for ways, that are less and less invasive and less painful to say. We've come up with what we call high intensity focused ultrasound. So ultrasound waves are sound waves, at a very high frequency that you cannot hear, but they penetrate tissues. So if you're able to focus them on the area that has the problem, they are able to destroy those tissues. So what happens is that, it's just something placed on your tummy, and then it penetrates to the tissues, destroys a specific area that has a fibroid, and then over time, maybe months, they will shrink and completely die off. It's something new, but I believe we are now offering. There are quite a number of my colleagues who are offering it in Nairobi, and it's showing quite a lot of promise. If these are not at somebody's disposal, or certain choices make them opt for surgery, then surgery is still an option. And in this, there are two approaches and there are two types of surgery. There are those people who say, you know what, I have suffered with these things, I have enough children, or I don't want children, I just want everything out. So we call that a hysterectomy, where the whole uterus is removed together with the fibroids, and that stops all the bleeding. There are people who may still desire to keep their organ or to have future fertility. So those ones are offered what we call myomectomy, where we just go cut out the fibroids wherever they are, then we repair the uterus and we leave it intact. These the methods that we use. It can either be minimally invasive, where we do keyhole surgery, it's called laparoscopy, or sometimes when that is not available, or maybe they are too big, we do the traditional where we just cut normal surgery. What determines what approach of all those treatments I've talked about, from not intervening to giving medication, to doing ultrasound, or to doing interventional radiology or surgery, is the dynamics of the whole picture. basically how old is the woman, what are her fertility choices, what are her symptoms, and how extensive are these fibroids. You have to put it all together for you to be able to come up with a plan. Now, if I was to go through probably each of the method based on fertility desires, there are some methods that may not be appropriate for somebody who has fertility desires. So it's good to mention that a woman who needs probably to have babies later may not be advised to go for a hysterectomy, may not also be advised to go for the interventional radiology, because we are not sure of future fertilities. But the other methods will work for most. Yes.
Yeah, the other methods, and that's very important. I think that is a decision you discuss with the patient or the person in the picture.
Yes.
That's very important. For our viewers, you get it from our expert today. It's not always surgery. There are interventions that can be made. It's a discussion they make with you. Are you interested in having children? When he talks about hysterectomy, he means taking away or removing the entire uterus. And you know, if you don't have one, you cannot conceive unless a miracle happens. We've had that. So, Daktari,
Yes.
I think it's safe now to advance into the next step, because there are women, mostly in Africa, we get to discover a lot of these complications or issues when we are in optimal states, or like states whereby, for example, someone is pregnant, you know, they discover they have fibroids. How do you go about that?
Okay.
Yeah.
So, like I said, two things. One is that it's not entirely impossible to conceive with fibroids. So people do get pregnant and we find them in pregnancy. Second thing is that there may be some complications that occur with that pregnancy. It's not always that those complications will occur, but there is a slightly higher risk when you have the fibroids.
Yeah.
One of those complications is, of course, a miscarriage, because maybe implantation or maybe the uterine cavity size or shape has changed and so on. So there is a slightly higher risk of miscarriage. I also said there is risk of pain. As the uterus grows in size, there are changes occurring to these fibroids that can lead to pain. Also, they can start bleeding and cause a lot of distress in the pregnancy. Now, we are usually able to pick this early, you know, because pregnant women are very keen on speaking out. So when we pick that out, we are able to not only put her in on good follow-up, but put her on medication that can try either to quieten the uterus, to make it less responsive, you know, to stimulation, which can reduce the risk of a miscarriage. We can be able to put her on something to reduce the pain. And if there is bleeding, we can also be able to put her on something to stop the bleeding and probably to boost her blood levels. So it all comes down to it being picked early. And that is what probably might be a game changer for most women who proceed through pregnancy without issues. It's good to note that most of those interventions we were talking about that are invasive cannot, of course, be done in pregnancy, because you'll harm the pregnancy. You can't go to operate, you know, on a pregnant uterus. You can't try and put ultrasound waves where a baby is involved. So when you find yourself pregnant, you may have to hold on until you deliver, and maybe after, and then that's when we can comprehensively deal with the fibroids. There's a question I get a lot from women, pregnant women with fibroids, and they usually ask, Daktari, we cannot do, a cesarean section and then we remove the fibroids at the same time. That's a very common question. And the straight answer is that it's not very safe, because you're dealing with a very large uterus whose blood supply has increased more than 5 times. So anywhere you cut is bound to bleed a lot. So it's not very advisable to have the 2 surgeries at the same time. And we usually advise them, go have your baby breastfeed. We can always deal with this later.
Wow. I like it when you begin off with questions, because I have so many here again for you to answer.
Yes.
And for our viewers, thank you so much again for following Faith-Based Television. Again, remember to like, subscribe on our YouTube channel and other socials, because it makes a great difference when you do. We have Lily here. Lily says, good morning. Do fibroids always lead to infertility, or is that a myth? That is Lily.
I can respond. We had mentioned that.
Yeah.
No, they don't always lead to.
They don't always lead to fertility.
Yes,
We have Inam Royster in Umo. Okay. The question is, are fibroids genetic? Like, if my mom had them, am I more likely to get them?
Yes, to a large extent, there is a family history association.
Yeah.
It's not a direct causation.
Yeah.
It's an association, and it's not a direct link that, yes, mom has, you will get. No. It's just a higher risk within families.
Okay, it's a higher risk. So probably, I think that's a discussion you need to engage. If you hear there's fibroids in your family, what do you do now to prevent?
Good question, actually, and I like that you've gone to the issue of prevention, because medicine is now looking more towards that. And the straight answer is we haven't found an exact preventative measure. Okay, it has been proposed that a diet higher in vitamin D, maintaining healthy weight, so that you're not obese, may play a role in reducing the risk of fibroids. But per se, to say there is a known preventative measure, to the best of my knowledge, we don't have enough evidence. Now, granted, not having evidence does not mean there isn't. It's just that you haven't found. So I may be speaking like this, and tomorrow or next week I have a different opinion based on how far science has gone. So in terms of prevention, not very sure. Generally, living a healthy life is generally advised. Yes.
I know that when you reach that question, most of the doctors there are careful. I don't know, is it because you don't want to give us the exact way to approach that, or it will affect business?
No.
Anyway, it's a conversation we had somewhere, and it is something that has always come up. But like he has said, a healthy, it's important. And you see, talking about the uterus, you talked about most of these fibroids being hormone dependent. There are people who use different contraceptives. Could they also affect the likeliness of fibroids? Maybe you could add something on that.
No. Actually, on the contrary, some small studies had suggested that the contraceptive, the oral pills, might actually reduce the risk. I am not very convinced with the size of that study.
Maybe because it is not documented.
Yes.
That's why you feel it is not. What about foods? Doctor, feel free to deliberate on these issues, because I'm sure people will benefit.
It's a topic that is coming up because people are asking, is it that we do a lot of starch where we are? Is it that we do a lot of food with sugar and less of the vitamins? Yet again, I said it's a gray area because not well documented, not enough studies to guide practice.
Yeah.
So in medicine, you know how we do. You accumulate, a lot of research, a lot of studies, and then you're able to guide practice. But when it's still an area with little evidence, you really don't want to commit yourself.
Okay.
Yeah.
All right. We have another one who is asking a question, no name though. What's the right time to talk to your partner about fibroids if you are planning marriage or kids?
Okay. This is even more of a counseling psychology question. But I think you should be open. When you're getting into, a lifelong relationship with a partner, and one of the goals is reproduction.
Yeah.
I think you should be open enough to, when you're taking things to the next step, to let them know that maybe you had an issue that was diagnosed or it was dealt with, and just be open about it, because should you not, it's probably going to bring issues later.
Yeah, very important to have this discussion. And for the viewer, it's important you have this discussion with your partner so that they don't get surprises. We have Esther. Good morning. I am Esther and I love the conversation. Thank you, Esther. My question is, why is it that many women only discover they have fibroids when they are already struggling to conceive?
Like I said, it's because of the symptoms. Most times women will not get symptoms, or they will get symptoms that are masked. Like you may have noticed, like the last 5 years, your periods have been heavy, but you've never really bothered. So now when it comes to conceiving, now that is the first time you start to discover. So it's very common.
Very common. All right. Someone is asking Kimi. I was told, she says, hello, I was told I have fibroids, but they are small.
Okay.
Could they still affect my chances of getting pregnant?
No, it's not a must. You can still conceive. The best thing would be, when you're taking that journey, work with someone, work with an expert in the area, have your investigations done. You can have a scan, and then now you can walk the journey through conception and pregnancy with them. So it's not a must. And like I said, many women conceive even with fibroids, and it's not a bother.
So should we just let them be and let them grow?
No. Like I said, when we decide not to intervene, we are not washing our hands off. We are doing what we call watchful waiting. That is, we are monitoring. Are they growing? Are they causing any symptoms? And do we need to intervene? Because if I do a scan today and they are probably 2 centimeters, and we come 2 months later, they are now 4 or 5 centimeters, definitely they are going, and you can't just let them be. But if you do a scan and maybe it's one fibroid, it's 1 centimeter, 2 centimeters, no symptoms, then you come 2-3 months later, it's the same status quo, you probably would not be too keen to be aggressive. Okay? Because those interventions have their own complications. So you want to avoid them as much as possible.
So aggression comes at a certain level.
Yes.
That's what you're trying to mean. Thank you so much. And I have Jacinta here. We have a number of questions coming in. If you remove fibroids, can they come back again and stop someone from conceiving? That's Jacinta from Kiambu.
Okay. Yes, another common question.
Yeah.
And the answer is yes, but it always doesn't happen. Remember, this uterus has the fibroids we are seeing, but there are other tiny ones that may be 0.5 centimeter, less than 0.5 centimeters, that you are not able to target or to remove, whichever method you decide to use. So those ones can still grow again. Yet again also, remember, even if we removed all of them, you still have the inherent risk factors that you had before. whether it was family history, whether it was genetics, you still have those risk factors, so they can still form new ones. But from personal experience, what we call anecdotal evidence is that this does not happen often. It takes very long. By most time, the woman is already out of the reproductive age group. So the fibroids cease becoming a big problem.
Wow. Thank you so much. We have a question here. What are some of the other issues that could affect fertility apart from fibroids?
Yes.
Yes.
It's good to mention so that we don't leave this discussion and people tie fibroids, fertility.
Fertility.
In fact, if I was to put the top 3 of the causes of fertility issues, I don't think fibroids would come there. Okay? If we were to just take a brief overview of what fertility entails, is that there has to be a healthy gamete from the man. It has to be able to travel through the whole reproductive canal, through from the cervix to the uterus to the tubes, and it has to meet a healthy egg from the woman. So of those 3 requirements, those form the biggest causes of fertility issues. The tubes can be blocked, either from other diseases, sometimes from fibroids, but it can be other diseases like infections. It can be other conditions like endometriosis. It can even be from prior surgery, maybe prior operations done in the pelvis for other reasons. That can block the tubes, meaning that because they are very fine passages, meaning that the gametes have nowhere to pass through. Another top reason is that either the man or the woman may not be making a healthy gamete. For the woman, we call it an ovulation, where she's not ovulating. So there is no egg, for fertilization to occur. Usually this will be accompanied by other things like irregular periods or lack of periods and so on. Then we can have issues with the man. It's often forgotten that the man contributes even more than a third of the cases of a couple not having a baby. Then there are other less common causes now, like fibroids or things that may occupy the cavity of the uterus, and other diseases that may cause the woman not to ovulate.
I think you have given a very nice summary, and I commend you for that. The doctor here is trying to emphasize and set in clarity that it's not only fibroids that bring fertility issues. He has talked about endometriosis. You've talked about endometriosis, and that's a discussion that we have been looking forward to have on this show. And I think that is what we can carry on to break down next in our next session, because of time, because I feel like you have more to share, and given the quality you've given us, we cannot get enough from you. Do you have parting shots for us as we wrap up for now?
Yes, I do. One is that fibroids are very common, and you should not feel stigmatized if you or you know somebody who has them. Let them know they are not forgotten. We are there for you. They don't always cause symptoms, but when they do, there are interventions that we can do to help you. It's up to you to open up to your specialist and let them know what exactly you want solved. They can interfere with fertility, yes, but there are also other causes of fertility. What you need to know is that there is a solution. Even if I was to use maybe like the scripture, there are stories of people who could not conceive and they were not forgotten. I think there was Abraham and Sarah. There was, I think Samuel was born after the mother had suffered for some time. So you've not forgotten you. God has not forgotten you. There is a solution for you. Yes.
Maybe with that solution, you could as well share your number so that people get the full-blown solution when they interact with you.
Yes. So like I introduced myself, I'm Dr. Tung'ani Muchiri. I have a practice in Roiro, and my phone number is 0780 477 862. That is 0780 477 862. You can reach out by WhatsApp, and then I'll be able to chat back and guide accordingly.
Wow, thank you so much, Dr. Muchiri here. And we are really honored with the expertise you've given us on Faith Television. I can't wait to have that discussion on, you called it what?
Endometriosis.
Endometriosis.
Yes.
Exactly that. So in our next session, I'm sure he's going to give us more detail and information you need. Like he has talked about solutions. You would want to have solutions from such a kind who is also a believer, and with the story he has, actually, we have not even dug today. We have just scratched the surface. So thank you so much. For our viewers, it's important to note that fibroids, yes, they are common, but that should not be the end of the story for your fertility journey, your journey to motherhood. There is still hope, like he has said. So it's important that you get the awareness first. It's important that you get the right diagnosis, and also timely treatment can help you on this journey. We remember those who are in hospital or watching this from home or wherever you are on your gadget, and you are struggling with fertility issues, with bearing children. There is still hope. This gentleman, like he has said, there is still hope, and the scriptures also emphasize there is still hope. So do not lose the hope. We also believe that the doctors, whatever they're doing to you, they're only an extension of God's healing hand. So do not give up. Thank you, JCK Hospital, for making this program possible. My name is Enock Kitondekijja, and you have been watching the Healthy You program. Until we meet next time, stay proactive, stay informed, and stay healthy. God bless you.
At JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital, you first.